Well, good afternoon, everyone, and welcome to the first meeting of the Joint Assembly Senate Conference Subcommittee on Health. Uh, I'm Richard Gottfried. I chair the Assembly Committee on Health, and in a moment I'll be introducing my Senate counterpart, Senator Rivera. Uh, we are here today with the Senate to examine the proposed 2021-22 state budget related to the Department of Health, the Department of Financial Services, and the State Office for the Aging. Um, the assembly members of the subcommittee are Kevin Cahill, chair of our insurance committee, Ron Kim, chair of the standing committee on the Committee on the Aging, and assembly member Maritza Davila, Assembly Member Kevin Byrne, who is the ranking minority member on the Health Committee. Uh, and our three alternates are Assembly members Carinas Reyes, Daniel Rosenthal, and Jacob Ashby. And on the Assembly side, our recording secretary will be Cynthia Jacobson. And now I will hand it off to Senator Rivera.
Thank you, Member Gottfried. Looking forward to the point where we will be doing this around in a dais somewhere, sitting next to each other, but we're still in the virtual world. So here we go. So again, my name is Gustavo Rivera, chair of the Health Committee in the Senate and co-chair of this conference committee. I'm joined by my assembly colleague, my Senate colleagues, uh, Rachel May, who is the chair of the Aging Committee, Julia Salazar, who is both the chair of the Committee on Women's Issues, as well as Crime Victims, Crimes and Corrections. And we are not joined by my colleague Neil Breslin, who is the chair of the Insurance Committee, but is debating a bill on the floor of the Senate. We're also joined by my ranking members, Patrick Gallivan, who is the ranking member in the Health Committee, and as alternates, Peter Harcum, who is the chair of Alcoholism and Substance Abuse as an alternate, and an alternate on the minority side, Senator Oberacker, who is the ranking member in Alcoholism and Substance Abuse. Back to you, sir.
Okay, so the Assembly and Senate budget proposals, uh, in our one House proposals have an enormous amount of overlap. Uh, and I would say the areas where we disagree are really pretty easy to resolve. Uh, they're almost all things where uh, our aims and our policy views are quite similar. Uh, the big challenge, of course, will come as we now proceed forward uh, to negotiate the budget with the executive branch, uh, presumably to produce a finished budget uh, in the next 2 weeks. Some of the highlights of the assembly package: we increased general public health items by a total of 435 million. We increased Medicaid spending by 376 million. Uh, we would eliminate the Medicaid cap, uh, eliminate the 1% across the board Medicaid cut, uh, restoring $94 million. And all these numbers are state share. We would put in $60 million to restore the Medicaid managed care quality pool, 20 million additional funding for workforce recruitment and training, particularly focused on nursing home CNAs and home care personal care aides. Uh, $12 million to restore cuts in the early intervention program. And in particular with early intervention, we would create we would draw $40 million from the Covered Lives Assessment pool for early intervention. And at the same time, eliminate the responsibility of any insurance company for paying for early intervention services, which they by and large don't do anyway. Those are some of the highlights of what we have in mind. Gustavo, hand it over to you.
Thank you. Thank you, Assemblymember Gottfried. As the Assemblymember stated, we have a lot of agreement, and I'm very thankful that that's the fact. It shows the type of work that the Assembly and the Senate can do when working together. And we certainly have, there's a lot of things that that Assemblymember Gottfried mentioned that certainly were part of our priorities. Just a few more that I would like to underline that were in our One House budget resolution. Among other things, we have the bill, that was my bill, that grants otherwise ineligible New Yorkers with confirmed cases of COVID-19 eligibility to the essential plan, regardless of their immigration status, because we believe that these folks, they also need to be protected. And I'm very proud that we were able to include that in there. As Assemblymember Gottfried said, as far as restoration to Medicaid's cuts to hospitals, as well as long-term care, and our mainstream managed care. But I'd also add that we added protection to 340B providers by repealing the pharmacy benefit card, which is something that we know will have an enormous impact, a negative enormous impact on safety net hospitals and federally qualified health centers and Ryan White providers all across our state. We also included language to create an opioid settlement fund that we believe needs to be focused on fixing the damage that was done by many of these companies. So we are, our Attorney General continues to negotiate those settlements, we want to make sure that those funds go to those purposes, to make sure that we can provide services to those who have been harmed by these companies. And last but certainly not least, our One House budget resolution, it provides $624 million to increase the minimum wages for home health care workers. We know that there's more that they need, but we knew that we had to be balanced in our approach, but we do believe that it is important to include it on there. So all of those, as well as as getting rid of the Medicaid cap, which, as we've said many times, might have been useful back in 2011, but is no longer something that we need to continue. It just speaks to austerity budgets around Medicaid and healthcare, and we need to move in a different direction. So, but as some members said, we have a lot of work to do in the next couple of weeks to get it done. But I'm very glad that we agree, the Assembly and the Senate agree on so much, and looking forward to working with the executive, whomever it may be, to make sure that we can finalize a budget by the 1st of next month. Assembly member?
Okay, I think we'll go back and forth, seeing if members of the committee want to make additional comments. Why don't you, do you need me to unmute you, or can people unmute themselves?
I can prompt an Assembly member. You have Assembly member Cahill.
Okay, Mr. Cahill? Needs to be unmuted.
Did that once.
There
Okay,
you go.
I think we're there. I said it's great to see everybody once again, and to the new folks. It's great to see you here, and thank you for participating. A couple of just general points that I'd like to make, and that is that I think the Assembly in particular went to great lengths to narrow the Article 7 portion of the budget, but not to eliminate the policy issues that are included in there. For example, today in the Insurance Committee, we moved Dick's medically fragile children bill. That was in some form or another included in the budget, and we'd like to go forward with that. I also would point out that as much as we state our aspirations in our individual House budgets, the rubber hits the road when we get the table target. And just by way of talking to my colleagues about going back to our leaders, I think every year we know that the table target is a mere fraction of what we actually need for healthcare. I think it's incumbent upon us to impress leadership that we need a larger target that's more closely related to that, which includes our asks. I do note that there's a difference of about $1 billion with a B between the Senate proposal and the Assembly proposal, and I recognize, as Senator Rivera pointed out, that a lot of that has to do with the minimum wage, with the wage increase for healthcare workers. That being said, I would think it would be very useful for the committee members to have at our next meeting, or even before our next meeting, some sort of indication of what is the actual difference between the two houses. The 800 million in our house and the 1.8 billion in your house and the Senate House may only be different by that $1 billion, or there may be a more significant difference. I think that's important to know. Just last and least, I have a couple of points that I'd like to raise. Early childhood education, early childhood intervention programs are very important. We included the $40 million in our covered lives assessment. That would come from existing funds that are provided by insurance companies, but would otherwise be refunded to them at the end of a fiscal year. I suggest that we need to continue to work on the language, and I would rather have it be legislative language than executive administrative action in that regard. The Entertainment Workers Demonstration Fund was set to expire. I know that the Senate joined the governor in continuing the $110,000 closeout amount that was included in there. But given the way that Broadway in particular shut down this year, there is a need to restore that program at least partially after the federal money is spent at the $2 million level. That's what we put it in at, and that should cover everything from October forward. I have a couple of other issues. One, I think it's time to congratulate the Senate on moving the pharmacy benefit management bill. That is a real pharmacy benefit management package as opposed to the shell of a registration program that the governor offered in his budget. And I would hope that we in our house can do the same before the budget and present that to the governor in lieu of. With that, I thank my colleagues for all your hard work, and look forward to working with you in the coming weeks to arrive at a budget with, as Senator Rivera said, the executive, whoever that may be.
Okay. Senator Rivera?
Yep. A thing, yes, some member, one procedural thing that has to be done is that both the Assembly and the Senate have to designate a recording secretary. And for that, the Senate will appoint Carolyn Sheridan, who has already started doing the gig, even though she had not been officially appointed, so to speak, but she has been taking notes of everything that's been said so far. And with that, I will actually pass to my Senate colleague, Senator May, if she wishes to make some initial statements.
Yes, thank you, Senator Rivera, and all my colleagues for your good work on the two one-house budgets. I want to underscore, so as chair of aging, one of my major points of focus has been trying to build up the home care workforce. And so the $624 million that we have in our one house to raise that wage for the lowest paid home care workers is a very high priority for me, along with the Article 7 language that goes with that. I see that as part of a larger push over multiple years to really build an economy of paying home care workers a living wage and building up that workforce so that people can age with dignity in their homes. We also have in our one house $27 million for community services for the elderly, which will enable thousands of seniors to get off the waiting list for in-home services. And we were able to offset that, more than offset that, in the Medicaid budget with an estimated $60 million in savings for the many of those people who would be able to stay out of nursing homes. So I hope my Assembly colleagues can support that as well. And then I wanted to just mention, we passed my bill for beefing up the long-term care ombudsman program. And I congratulate the Assembly for putting money in to support that, $1 million. We didn't put any in the Senate budget, but I hope that at the very least that $1 million can stay, and if not more would be welcome. So thank you again, and I look forward to continuing to work together.
Okay, back to
Okay.
We have Assemblymember Byrne.
Assemblymember Byrne, our ranking minority member.
Thank you, Mr. Chairman. I know in the years leading up to this pandemic, public health programs continually had their funding reduced, which likely contributed to added challenges within our state's response to the pandemic. The executive budget did not adequately address the need to restore and support many of these programs. I and many of the members of the Assembly Minority Conference are encouraged that the Assembly One House does include increases in funding for vital public health services, including local health departments and local public health initiatives, but also acknowledge that more work needs to be done. We support the restoration and increase in dollars that was cut in last year's budget, funding the Centers for Community Health Program, which supports various local health departments made up of people who are on the front lines fighting this very pandemic. We join many of our colleagues in the Assembly majority in voicing our opposition to the governor's proposal to discontinue the Equal program and support efforts to provided in the Assembly One House to improve the state's support of long-term care ombudsman. I and many members of the Assembly minority support the restoration of the Adult Cystic Fibrosis Assistance Program in statute and in funding. The Assembly Health Committee reported a bill earlier this year doing that as well. But to think that our state eliminated this program in last year's budget while in the midst of a pandemic caused by a virus that attacks a person's respiratory system is unconscionable. And I'm glad to see that that's being restored in the Assembly One House. While we support the postponement of the fee-for-service transition until 2024 for 340B and certain HIV providers in the Assembly One House proposal, many of us, including myself, prefer the repeal of the provisions related to the fee-for-service transition as proposed in the Senate One House. We reject the proposed continuation of county sales tax intercept as included in the governor's proposed budget. These sales tax dollars should not be transferred into the state's general fund, and we should be careful to avoid intercepting additional sales tax dollars from county governments in the future. We reject the governor's budget proposal to cut funding to the excess medical malpractice program, shifting greater costs directly onto physicians. Many of our members look forward to opportunities separate from this budget to embrace tort reforms that could also reduce the overall cost of medical malpractice insurance in our state. Likewise, we too reject the governor's proposed elimination of prescriber prevails and was happy to see the Assembly majority, the One House did that as well, and reject the executive's proposal in the budget to provide enhanced powers to the DOH commissioner to disclose allegations made through the Office of Professional Misconduct before proper due process is given. Also, for Hudson Valley families, I personally would oppose and ask colleagues to reject the proposed closure of the Rockland Children's Psychiatric Center in the final budget and move that would move many beds to the Bronx and seriously limit the ability for Hudson Valley families to visit their loved ones. In lieu of the governor's growing list of scandals, calls for his resignation and impeachment, the Assembly Minority Conference continues to support all investigations, including the work by our colleagues in the Judiciary Committee into the executive related to the underreporting and cover-up of nursing home deaths. Likewise, in the Assembly One House, we reject the governor's proposed 30-day budget amendments related to nursing home reforms. I and others in our conference contend that many of the proposed policies in the governor's 30-day budget amendments should first be discussed with all stakeholders so it can then be reviewed, discussed, and debated independent of our state's budget. And in several cases, this has already occurred in the Assembly. Some reforms in the Assembly have heeded recommendations from the Attorney General Letitia James's January report, as well as testimony from our joint Senate Assembly legislative hearings in August. We must further acknowledge that vaccine distribution is vital to ending this pandemic, and that with an influx of federal funding for vaccines and vaccine distribution, we must ensure that an efficient and equitable distribution exists for those that want this vaccine. Any efforts to strong arm or gauge political support for the governor and possibly link that to vaccine distribution should be examined along with the nursing home cover-up. And lastly, I and many members of the Assembly Minority Conference continue to express concern with the repeal of the Medicaid global cap as proposed in the Assembly One House budget resolution. After a year in which we recently faced a $4 billion structural deficit, primarily credited to Medicaid spending, the repeal of this cap raises concerns that spending could increase significantly to unaffordable levels for New York residents. Based on the recent census, our state is already positioned to lose one or possibly two representatives in Congress due to the growing out-migration crisis in our state. Thank you, Mr. Chair, for allowing me to make my statement.
Okay, Gustavo?
I'll pass it to my ranking member in the Health Committee and representative of the minority in this Conference Committee, Senator Patrick Gallivan.
Thank you, Senator Rivera. On behalf of the Senate minority, I'm happy to see that both the Senate and the Assembly restored the majority of Medicaid cuts, including prescriber prevails, indigent care funding for public hospitals, and the 1% across the board cut to Medicaid rates. As New York recovers from the pandemic, cutting hospital Medicaid reimbursement is certainly not prudent. We're also pleased with the restoration of funding for the excess medical malpractice pool to ensure our doctors are able to afford coverage and continue to practice within New York. Pleased with the rejection of the scheduled carve out of the pharmacy benefit from managed care to fee for service, preserving the 340B program for our state safety net health system. Safety net providers that participate in the 340B program realize critical savings that they need to care for New York's most vulnerable communities, and those savings must be preserved in full. We have concerns regarding the rejection of the Medicaid global cap. Both the Senate and Assembly one-house budgets increase Medicaid spending by over $2 billion. While it is important to ensure New Yorkers have access to quality and affordable health care, eliminating the self-imposed cap can lead to more waste and inefficiency, leading to future budget deficits and unsustainable growth. And finally, we're concerned about the lack of funding to help healthcare facilities, such as nursing homes and assisted living facilities, to meet the resource demands implemented by state mandates, such as PPE and testing requirements. We look forward to working with our colleagues to implement a fiscally responsible budget that provides sufficient funding for healthcare initiatives throughout the state. Thanks.
Senator Gallivan. I'm going to guess that the last thing he was going to say is responsible. Is everybody
did.
frozen or am I?
Did you miss that?
Did I freeze?
I think we all did, Senator.
Okay, so everybody froze. Wasn't just me. I was thinking I was just talking to myself. Senator,
Where did I leave off?
you left off with a responsible, a fiscally responsible, and then you kind of went off into the ether.
Oh, I was just saying, look forward to working towards a fiscally responsible budget that provides sufficient funding for the healthcare needs of our residents. Thanks.
Right. Thank you, Senator Gallivan. Back to you in the Assembly, sir.
Any further remarks on the Assembly side? I guess not.
None in the Senate either, by the way, at least not for my.
Assemblymember Ron Kim.
Oh, okay. Assemblymember Ron Kim.
Thank you, Chair. I just want to say thank you to our chairs on the both sides, Senate and Assembly, and Senator May, for all the tremendous work you're putting forward. I do want to support the stronger language in PBM. I know that Mr. Cahill and Dick Gottfried had been pushing for better oversight and accountability around PBMs for years. So I'm glad that we can try to push that into our budget. I do want to echo the senator's urgency, Senator May's urgency in terms of making sure that we can fully fund our home care services. I know that Chairman Dick Gottfried just introduced a bill around the fair pay for home care. I hope that we can fight to put that into our budget. And I know that the Senate put in the 27 million for removing seniors from wait lists for all the critical services, and I hope the Assembly can work to match that moving forward as well. I am very grateful for the 2 million that the Assembly put in for NORC and neighborhood NORCs, as well as the 1 million that we put in for the long-term care ombudsman program. I hope that stays in the final budget as well. Thank you so much, Mr. Chair.
Okay.
I believe, Mr. Chairman, Co-Chairman, that there's one more procedural. Well, first of all, you have to, on the record, designate your recording secretary. I believe that has to happen.
Okay. I think I read off that it is Cynthia Jacobson. If not, it's Cynthia Jacobson.
If I missed that, then my apologies, but now it's on the record, if we once or twice. And
Okay.
one more procedural matter that relates to the guidelines for conference committee process. These are 7 guidelines which were emailed to everyone. I will not read every word, but I will read some of it into the record to make sure that they are that we acknowledge that these are the guidelines by which we shall operate. 1, co-chairs shall determine all matters of parliamentary procedure unless otherwise specified by these rules. 2, the co-chairs shall each designate a staff person to serve as secretary for the purpose of taking minutes. We've already done that. 3rd, an alternate, and there are 2 alternates in each one of the in the assembly and 2 alternates in the Senate, may participate in a subcommittee meeting but shall not vote upon any deliberations of such subcommittee unless he/she has been designated to fill an excused vacancy in each subcommittee. And then it goes on to describe how such designation shall be made by the co-chairs, etc. 4, no subcommittee members or alternate members shall be permitted to participate via proxy. So you have to be present to participate. 5, subcommittee shall restrict their deliberations to the respective subject areas as determined by the General Conference Committee. So we will stick to the agencies that were named earlier by the assembly member. 6, each member shall be permitted a reasonable period of time as determined by the co-chairs to discuss any matter germane to the subject area of the subcommittee, as we did earlier today. And lastly, no report shall be filed except upon the affirmative vote of the majority of the members of each house's delegation on the subcommittee. Back to the assembly, sir.
Okay. I don't think I have anything more to add, unless there are other assembly members who want to make comments. But hearing none, I think we may be ready to adjourn.
All right. We're good in the Senate side as well.
Okay. Well, then
Motion to adjourn?
we are adjourned.
Adjourned.